Welcome to Middle East Dialogues, a series of conversations with leading scholars and writers, produced by the University of Denver's Center for Middle East Studies. Your host for this episode's dialogue is Associate Director Danny Postel. Our guest is Dr. Zaher Sahloul, an Associate Clinical Professor of Medicine at the University of Illinois at Chicago and a practicing physician in pulmonary and critical care. He is also the founder of the American Relief Coalition for Syria, a coalition of 14 U.S.-based humanitarian organizations working in Syria. He is also a senior advisor and the former president of the Syrian American Medical Society, a leading international medical relief and advocacy organization for Syrians and Syrian refugees, which has treated 2.6 million patients in 5 different countries.
Well, the first thing I want to say, Dr. Sahloul, is welcome to Denver, and specifically here to the University of Denver. It's a great honor for us to have you on our campus, and thanks for joining us for this conversation before your event today.
Thank you, Danny, and thank you for inviting me. I'm really honored to be in Denver in this important institution, and hopefully we can shed some light on what's happening in Syria, especially focus on the humanitarian crisis.
Well, that's exactly where I'd like to begin. Talk a little bit about the medical dimension of the Syrian conflict.
This is one of the most important part of the crisis in Syria, that the medical system in Syria have been targeted throughout the crisis for many reasons. There are many reports that came out that early in the crisis, the Syrian regime especially targeted doctors and nurses who've been treating people who were injured early in the demonstrations. And
why was that? Why were doctors and nurses specifically targeted by the regime with repression?
Because I think if we understand the mentality of the regime, that they believe that anyone who is supporting or helping people who rose up against the regime, then that means you are supporting the enemies. And there was a law that it was enacted early in the crisis that if you are a doctor and you treated someone who is injured in demonstration against the regime, or you are treated someone who was in area that is controlled by armed group, then you are considered terrorist.
So even before the conflict became violent, in the first several months of the uprising from March 2011 until the end of 2011 when the Free Syrian Army formed, but in those first 7-8 months of the uprising when it was peaceful, you're saying that doctors who treated even peaceful demonstrators who were injured?
I mean, that's why we had many doctors who started to build hospitals underground. We called it field hospitals because they could not treat these patients in public hospitals. There were many reports early in the crisis when the demonstrations were mostly peaceful, that the security forces came to hospitals and they pulled out patients from the intensive care unit, sometimes from the OR, and these patients were, died eventually. They also detained physicians who were treating them, and they tortured them. Many of the physicians who fled Syria early in the crisis were detained and tortured by the by Assad regime. And that's why people went underground, doctors went underground, and they started to build these field hospitals in basement of buildings, in sometimes chicken farms, sometimes in old factories, in basements of mosques and churches.
These are makeshift medical
facilities that you can treat patients secretly because you cannot treat them in public places. Because doctors and nurses were afraid on their lives. And if they were discovered, then they will be detained and tortured and sometimes killed.
I knew that was the case after the uprising became armed, and I knew that treating combatants, for example, with the Free Syrian Army or rebels was criminalized, but I had no idea that even in those first few months that it was illegal to treat peaceful, nonviolent demonstrators.
Oh, definitely. And that's why many of the doctors who are my friends, some of them, my friends and classmates, started to either leave the country because they could not stay and knowing that there's a threat on their lives, or eventually some of them have been displaced to areas that are outside of the control of the government when there was an armed opposition,
Yes.
and so forth.
So let's talk about the extent, the shocking extent of the medical crisis in Syria today. How has this conflict actually affected public health and the medical conditions inside the country?
So Physicians for Human Rights is an organization that tracks the numbers of attacks on healthcare providers in Syria and healthcare facilities. And so far they documented that there are 732 healthcare professionals in Syria were killed since the beginning of the crisis. More than 350 hospitals were targeted and bombed, mostly by the Syrian regime. Of course, some other armed groups also targeted healthcare professionals, but the majority, more than 95%, were responsible for the attacks, were responsibility of the regime. Because of that, you had forced displacement of healthcare professionals. The WHO documented more than 75%.
The World
of
Health
doctors,
Organization.
World Health Organization. More than 75% of doctors in Syria have left Syria. And Syria is a developing country. And when you have large number of doctors who are providing healthcare to the communities and neighborhoods leaving, then that means you have a huge shortage of medical specialists.
So this isn't just your typical brain drain situation, which is common throughout the developing world, as you say. This is a situation where Syria has this massive public health crisis with diseases, people wounded, people dying, and 75% of the doctors have left the country.
Have left, and then you have influx of trauma cases. I mean, you have bombing every day, and you have large number of trauma victims. You have disability, more than 2 million Syrians who have disabilities right now because of the injuries that they sustained through the bombing and the missile attacks and so forth.
So people have lost legs, have lost body
amputations,
parts.
eyes, spinal cord injuries. Then you have the psychosocial impact, psychological trauma because of the violence that are witnessed by the people.
I've seen it myself up front in the Syrian refugee camps in Turkey.
Yes.
I've seen it with the children, with the teachers, with all sorts of refugees.
Then you have shortage of medications. Before the crisis, 95% of medications were produced locally in Syria. And then you had many of the pharmaceuticals destroyed because of the crisis. So people had no access to medications for diabetes, for hypertension, for heart disease, for asthma, and so forth. Before the crisis, most people in Syria died because of non-communicable diseases, chronic diseases. And that was actually right now, the main killer for Syrians is not the bombing, but it's chronic diseases because people cannot afford to buy medications. They don't have access to medications. They don't have access to hospitals in the middle of the night. So if you have a heart attack in the middle of the night and you don't have a physician who can treat you, then these people die. We estimated that more than 200,000 Syrians in the last 4 years died because of non-communicable diseases. So this is a horrible situation in Syria. Not only you have bombing and you have areas under siege and you have no access to healthcare, but you have people dying with treatable diseases.
So you're describing essentially a humanitarian nightmare, Dr. Sahloul, and let's focus for a moment on the conditions inside the besieged areas of Syria. The Syrian American Medical Society, of which you were president, issued a major report approximately 1 year ago titled Slow Death, Life and Death in Syrian Communities Under Siege. One of the findings of that report is that there are no public hospitals in areas besieged by the Syrian government. So all of the conditions you've been describing, the medical and humanitarian crisis in Syria, is actually amplified on an even higher scale inside these besieged areas. Can you tell us a little bit, first of all, what are these sieges? What are besieged areas?
Besiege is a tactic that was employed by the armed groups, especially the government in Syria, because they wanted to force the population to disconnect from the armed groups and also to force armed groups to leave these besieged areas. So it's a strategy that was used starvation to force people to surrender, basically. And we're not talking about 1 or 2 villages or 1 or 2 cities. We're talking about large number of population under siege. So we have a large area around Damascus called East Al-Ghouta. more than 400,000 people are under siege for more than 3 years right now. No electricity, no running water through in the last 3 years for this area.
So they're cut off.
They're cut off completely from the outside world. Even if you have injured person or if you have someone who needs treatment for cancer or dialysis patients, you cannot leave this area unless you bribe a checking point. You have areas in west of Damascus called Madaya and Zabadani that has been in the news lately because we've seen children dying because of severe malnutrition and starvation. You had area north of Homs area in Aleppo, Deir ez-Zor, which is also under siege by ISIS. So all of these areas are under siege by different armed groups, most of them by the government. More than 800,000 Syrians are under siege. And we're talking about population who cannot seek medical treatment, who don't have access to medications, who don't have access to vaccinations. The vaccination rate in these areas is less than 10% according to the United Nations. That means you have many children who have mumps and measles and even polio. We had polio in 2013 and 2014 because the vaccination rate in some of these areas were less than 25%.
So polio, which the world believed had been eradicated,
right, and we
returned.
Returned in Syria. It was extinct in Syria for 15 years before the crisis. We had one of the highest vaccination rates in the region in Syria before the crisis. But because of the lack of vaccination due to the siege, then we had resurfacing of polio. More than 100 cases were documented, but there was a large campaign for immunization in Syria, and in the last couple of years we had no polio cases. But we had many other cases of preventable infectious disease in this area. And we have also severe malnutrition in many of these.
Yes, and this is what I want to talk about, is that these sieges also involve starvation as a tactic, as a tool of war, which has been declared a war crime by the United Nations. It's been condemned, these starvation sieges, which some describe as a kind of kneel or die, right? In other words, submit to the regime in most cases, in some cases ISIS or other groups, but it's principally the regime that has maintained these starvation sieges, and if either you submit to the regime or you will die by starvation. Can you describe specifically what these starvation sieges are like?
So, I mean, I talked with some of my medical friends who are still practicing in areas under siege. So just recently...
Which must be extraordinarily precarious to practice medicine.
Oh yeah, but I mean, I told them, why are you there? Why are you still there after 3 years from the siege in an area called Daraya, which is west of
which
Damascus.
I want to talk about because that's one of the principal places right now suffering from starvation sieges.
And this doctor told me, what else I can do? I mean, this is my community. I was trained to help my community, and this is the time that they are in need for me.
Yes.
So I have to stay. And I told him, can you describe to me what's happening in terms of the siege impact on the people? He said, you know, average person lost 20 kilograms in the last couple of years. I said, can you describe to me what you're eating? And he told me that we eat soup every day. So imagine yourself a family with children, and the only meal that you eat is lentil soup every day for 2 years. Imagine how much malnutrition you have. I mean, most of the children that we're seeing in the pictures from Madaya lost large volume of their body. They lost a lot of weight. Some of them have marasmus and kwashiorkor. These are severe malnutrition that we have not seen in Syria for ages. We've seen it in some pictures from Africa when they had famine and so forth, but we never seen it in Syria. And this is direct impact of the siege. The regime does not allow the United Nations, which is not far from Daraya or Madaya and so forth, to get into these areas under siege. And they will prevent, even if they allow sometimes involved, they take sometimes they take vaccination from these convoys, sometimes they take baby milk, sometimes they take...
So you're saying that there are these convoys full of medical supplies and food and humanitarian supplies, and they are on their way into these besieged areas to deliver these supplies to starving and sick civilians. Let's be clear, we're talking about civilians here.
We're talking about women and children. Most of the people who are living in these areas are women and children. Of course, you have men, but the majorities are women and children. Syria had one of the highest birth rates in the region. So you have many children. More than 50% of people under siege are children.
So these convoys are right there on their way into these besieged areas to deliver these supplies, and they're stopped, and then what you're describing is that some of these supplies, like baby formula and vaccinations, are being removed from the convoys?
Yes, and
In, in,
that has been documented many times, not only by us, by SAMS, and by the doctors inside, but by the United Nations. Mr. Stefan de Mistura, the special envoy
Yes.
in Syria, just last week, he mentioned that he was told by the Syrian authority that they will allow medical supplies, but they will take out surgical sets and atropine and anxiety pills. And he was talking only about medications. So, which means that the regime wants people to bleed to death in these areas if they are injured. Atropine is an antidote for chemical weapons. So, why are you removing atropine from these convoys? But our also doctors inside, they told me that they take out tuna. I said, why taking out tuna? They said they don't allow meat to enter these areas. So people are only dependent on vegetarian food. And because of that, they have malnutrition because, with vitamins, and with also many of them will have kwashiorkor, that we're talking about the children, because of this lack of protein food with protein.
Yes.
And baby milk. I mean, why would you take out baby milk from these convoys? So
this is a deliberate policy. This is not just some tsunami-like natural disaster. We're talking about a very calculated, very highly designed, choreographed policy of preventing medical and humanitarian supplies and food from getting in to starving civilians, children, mothers.
Oh, definitely. It's been systematic for the past 3 years. It has been documented by the United Nations. Mr. O'Brien, who heads the humanitarian arm of the United Nations, said just a few weeks ago in his report to the Security Council that more than 50% of the requests to enter these besieged areas in Syria were refused by the regime just in the last few months, when we have what's called cessation of hostilities.
Okay, so this really leads me in some ways to the crux of what gets under my skin every day, Dr. Sahloul. What is the answer to this, in my view, completely intolerable and outrageous situation? I mean, there might not be an easy solution to the Syrian conflict as a whole. There might not be an obvious way to solve this 5-year-long conflict. But when it comes to starving civilians, non-combatants, starving children, mothers who are dying, they're starving to death, there are medical convoys, humanitarian convoys with these supplies that could save their lives. They're not being allowed in. To me, this is simply not acceptable. There must be a solution. Now, in the SAMS report, Slow Death, you make some specific policy recommendations about how to deal with this. Can you talk about that?
Yeah, I mean, we believe that the international community, especially the United Nations Security Council, have failed the Syrian people. We're talking about now a crisis that has been going now for 5 years. We're talking about people starving to death under siege, with the United Nations agencies not far from them. We're talking about a Syrian regime that has been refusing access to these population who are dying because of the siege for the past 4 or 5 years.
And all of that has been declared illegal?
Declared, documented, reported multiple times by the UN itself.
And denounced by every human rights organization in the world.
Exactly. And then you have Russia and China vetoing any resolutions that forces, for example, the Security Council to enter these areas in spite of the regime. And I think this is something that has to be considered. Access and protection is the main responsibilities of the United Nations. We're talking about starving population. We're not talking here about armed groups. Civilians. We're talking about targeting hospitals, targeting markets. Just last week we had a fruit market in one of the cities called Ma'arat al-Nu'man, which was bombed, and more than 30 people were killed. And this is happening every week in Syria. We're targeting schools. So protection is something that I've been calling for the past 4 or 5 years. Protection of civilians, protections of hospitals, protections of doctors and schools, and also access to these areas under siege. The Security Council had a resolution 2139 early in 2014 that speaks about getting access to these besieged areas and protection of civilians, but it has not been enforced.
This is the key to me, I think,
yes,
enforcement.
Enforcement. How can you enforce it? This is something that the Security Council have to decide. They are endowed by the international community to protect peace and stability and security.
That's the mandate.
That's the mandate. And they are not doing that in Syria.
So, as you know, my colleague Nader Hashemi and I have argued explicitly that there needs to be at least the threat of the use of military force to get these humanitarian and medical convoys into the besieged areas to deliver these food and medicine to the starving civilians in Syria. That otherwise these people are dying, many of them already have died, and many more will die. According to the UN Food Program, possibly, and according to SAMS, if I'm not mistaken, as many as 1 million, perhaps more than 1 million Syrians right now are living under these starvation sieges. Is that right?
Oh, that's definitely. I mean, the United Nations OCHA report early last year, they said that there are about 22 communities under siege, about 212,000. We disputed that report, and actually,
you say it's more,
much more. I mean, we have 640,000 in people in areas that I've mentioned, but also if you added Aleppo, which are now becoming under siege,
yes,
then you have about 1 million people under siege. So definitely, anything that can be done to access this population, to provide food and medicine. We're talking about food and medicine. To these starving populations should be done, whether with the use of force or without force. Of course, if without force, that would be, much better. But what we have
we've
learned,
seen that hasn't worked.
Yeah, what we have learned in the last 5 years that without force behind resolutions, then nothing will happen.
And should the world simply stand by and allow the Assad regime and its backers in the international community to veto the delivery of these supplies, food and medicine, to starving civilians? And my answer has been no. And I, as you say, any means, I actually quoted Malcolm X, by any means necessary in our New York Times piece. To me, the key thing is the delivery of the goods, and whatever it takes to get the humanitarian supplies into these civilian populations, I think, is the key issue.
We agree. I mean, I agree with this, and we've been advocating for safe zones, for example, in Syria, where you have areas that have access, that you have easy access, where you have the population protected by no-fly zone, so they don't have bombs every day, that you can provide them with food and medicine. The NGOs can work without fearing that they will be killed, the humanitarian activists and so forth. And this is something that has been done previously in areas like Bosnia and so forth by the international community. So it's not something new.
Right.
Also, there was a proposition that was floated by France to modify the current system in the Security Council that will not allow countries like Russia and China to veto
or anyone,
because
the structure of the Security Council is that any one member of any one of the permanent members of the Security Council can veto any resolution. It just takes one vote.
When it comes to mass atrocities and genocide and starving population to death, I don't think that there should be vetoing power. And this is the essence of this proposition by France. We are supporting that. The system has failed Syria. The current system in the Security Council will fail Syria and will fail other countries that have similar conditions in the future, and somehow it has to be reformed.
So, Dr. Sahloul, we only have a few minutes left, and you're about to give a major presentation here at the University of Denver, but we've been talking about some ghastly, horrible things, and whenever one talks about Syria, unfortunately, at the end of the conversation, one sort of throws up one's hands and in exasperation and says, "What a nightmare! What a horrible situation." But one of the great things about your work is that actually the organizations you're involved with, the Syrian American Medical Society, the American Relief Coalition for Syria, are actually doing direct work. Not only yourselves, but you're involving a lot of people can go and volunteer, for example, with some of your missions. So I'd like to end on a note of what people can do. People who are watching this interview, people who feel a sense of outrage and compassion for the suffering of the Syrian people that you've been describing. Give us some examples of what they can do if they want to actually take action.
First of all, I think what you have mentioned is something that is very important. Sometimes we look at Syria and we imagine that it's only crises. But I just came in from Syria in a medical mission a couple of months ago. And what I've seen inside Syria, we're talking about areas that are bombed every day, that people are still living and they want to live and they want to educate their children. They want to build hospitals. I've seen hospitals built in the heart of mountains because physicians wanted to treat patients with protection. I've seen schools continue to operate in spite of the daily bombing by the Russian and the regime. I've seen markets that are full of life. Syria is a country that is very diverse. You have a big middle class. You have a large diaspora community that is very resourceful.
Yes.
That has been helping in the last few years. We just completed a convention a couple of months ago about post-crisis recovery. So the NGOs like SAMS and American Relief Coalition for Syria are planning for the day after. We want to rebuild Syria. And I think many of the things can be done by the average person. You can donate to SAMS, to Karam Foundation, to Syria for Relief and Development, many of the organizations that are doing work that is saving a lot of lives, providing education, mental health counseling to Syrians inside Syria and the neighboring countries. You can volunteer in some of the medical missions or the humanitarian missions that are done by these NGOs. Most of them are US-based and they have access to refugee camps in Al-Zatari, in Jordan, in Lebanon, in Turkey, in Greece. We started to send medical missions to Greece. You can also, we believe in advocacy. And I think one of the things that differentiated SAMS early in the crisis that we advocated on behalf of the doctors and the patients inside Syria. And I think every American should advocate on behalf of the Syrians. These are people who deserve our support. These are resilient people. And what's happening right now in Syria is the worst humanitarian crisis in our lifetime. Since the Second World War, this is the worst crisis that we will ever witness. We're talking about half of the country being destroyed, half of the population being displaced.
11 million Syrians either driven out of the country, 5 million refugees,
Right.
6 million internally displaced. But that's displaced. That's more than half of the population of Syria has been driven out of their homes and communities.
And it created a lot of instability in the Middle East and Europe because, I mean, the refugee crisis we are seeing in Europe right now is because of the Syrian crisis. The terrorism that we are seeing right now in some areas in the world, including Syria and United States and Europe, is because of this chaos created by the crisis. So we have to make sure that this country became more stable. And we have to make sure that there is a political transition. We have to make sure that people who committed these war crimes that we're talking about are accountable and they are referred someday to ICC or other court. So these are all things that can be done by the average persons. You can advocate to your congressman, to your senators. Organizations should advocate also on behalf of the Syrian. This is our humanitarian and civic responsibility.
Final question, just specifically, how can people find their way to, if they want to volunteer on a SAMS mission, for example, or get involved with the American Relief Coalition for Syria? How do they find these organizations? What steps should they take?
They can look at our website, sams-usa.net, and we have very easy platform to fill application for volunteering in medical missions. Other organizations also have the same thing, like Karam Foundations and others. And every couple of months, we have medical missions or humanitarian missions to go. If you would like to donate, you can donate through the website. We are charitable organizations, so your donations are tax deductible.
And you don't have to be a doctor or a nurse or have any medical training in order to participate in one of these medical missions that SAMS does.
No. I mean, in the last, we had a couple of weeks ago a medical mission to Jordan. We had 85 doctors, nurses, medical students, college students, interpreters, and people who provided support for mental health. Many of them are not related to the medical field, and they go there. And it's, first of all, these are very fulfilling missions. You feel good that you are doing something good, and people are very appreciative. The refugees in Al-Zatari camp are very appreciative when they see American person or lady who is coming from the United States and trying to provide help for them. They are very appreciative, and then you feel good that you are helping these poor population. And also you can come back and then talk about what you have seen.
Yes.
And what we have seen that stories about people and pictures and so forth are much more important than numbers.
That's right. Mm-hmm. Dr. Sahloul, this has been an honor and a privilege to have this conversation with you today. Thanks so much for sharing this perspective with us.
Thank you, Danny. Thank you.